RCM, Revenue Cycle Management. In today's billing landscape, practices face more challenges than ever before, with rising denials and pushback from payers, increasing lost revenue from aging accounts receivable, staffing challenges, and even by using outdated pricing and fee schedules, practices are suffering from massive shortfalls in the income they should be receiving and cash flow they should be enjoying. The Medical Advantage Group RCM Services team is here to help with our billing services and RCM consulting and advisory services.
So most practices that have billers in-house, they're being pulled in several different directions. They are not certified or current on the regulations for the current year. So typically what we find is the offices are understaffed, or they'll currently have one biller, which creates issues when that biller is on vacation or they're out sick. So as everyone knows, with the healthcare field, there's a lot of things that change on a regular basis. So one biller trying to keep up to date on all of those coding changes and the regulations that change on an annual basis is definitely challenging for practices. If they're understaffed and they're being pulled in different directions, maybe they're doing prior authorizations or checking in patients, and they're actually not able to send the claims out on a regular basis. So it does impact the revenue. What ends up happening is the claim is either rejected or it's not going out at all. So the issue is with the claim is rejected is someone has to go and follow up on that. For those claims that aren't sent out, that also delays the revenue because if they're not going out, the payments aren't going to come back in. So the services that we provide is medical billing service. What we'll do is once the physician signs the progress notes, we are going in and validating that information. So we're looking at the documentation. We're looking at what the physician coded to ensure that there's revenue maximization, it's in compliance with the insurance company guidelines. We will add any modifiers, we'll review the diagnosis on the claims, and then we will submit the claims to the insurance company. We will post any patient and insurance payments, and then also follow up on any insurance claims that are underpaid or denied by the insurance company. We will send patient statements out, and then we have a help desk line. So we have a toll-free number where patients can call with any questions that they have in regards to their statement. We will take that burden off the practice. Monthly, we provide reports to the practice. They will entail what are the charges, payments, adjustments, what is the AR for the insurance, what is the AR for the patient. In addition to that, we also have remote monthly meetings with the practices where we discuss any issues or concerns the practice may have and then how things are going on our side as well. The Medical Advantage Group provides certified coders and auditors, so you have the confidence that it's being done correctly and that your revenue is being optimized. Our consulting service consists of medical record audit and education. We will review the documentation from the provider and we'll look at what was billed out on the claim and ensure everything is appropriate. We also will review the insurance company payment to determine that they appropriately paid as well. As a result of the audit, we do meet with the management of the physician practice, go over all the results with them, and then we also meet with the providers and provide them with the education so that they aren't continuously making the same mistakes on the documentation that they're submitting. Another issue we find is the lack of follow-up from the practice's old billers. So we go in when we first receive an account and we will review everything that's out there and ensure that there's no filing limit deadlines that are coming up. What we find is there's claims that have not been followed up on or paid appropriately. So we will contact the insurance company, determine what needs to be done for the claim to be paid at the appropriate rate, or follow up and resubmit that claim for appropriate payment. Another part of our consulting services is the fee schedule review. So the insurance companies change their fee schedule on an annual basis, and if the practice is not reviewing what they're charging, they could potentially be limiting their reimbursement. Most practices have a fee schedule in place that they put in 5, 6, 7 years ago. No one's looked at it, updated it, reviewed it at any time. So for example, if an insurance company is going to reimburse $150, but an office is only charging $50, the insurance company will only pay $50 for that service. So we will look at their top payers and we will put their fee schedule together, look at the top payers' fee schedule, and then provide a recommendation of what they should be charging to maximize their reimbursement. Workflow assessment will evaluate the efficiencies, how things are being done in the office from a billing standpoint. Are the billing staff doing things efficiently in the system, and then provide recommendations. Another consulting service we provide is billing training. So if the office has hired someone who is new to billing or new to their system, we will go in and provide training on the system or for that biller so that they can learn the insurance company guidelines, the submission process for claims, and the best practices from a revenue cycle standpoint. We do provide credentialing services, so if a provider is hiring and they have a nurse practitioner or a new provider that they're bringing on board, we will do credentialing for that provider. If there is an insurance company that the provider is out of network in, we will go in and do the proper paperwork with that payer so that they can become in-network. We will also do their CAQH attestations for all of the practice as well. There's a lot of different insurance companies, and some of them have different regulations, different requirements from a claims standpoint. So our staff has certified coders and auditors that have to maintain CEUs, so they are up to speed on the current regulations that the insurance company has. So having the staff to keep up to date on those changes, that will help with your accounts receivable. Another unique aspect of Medical Advantage Group is the reporting capabilities. So we are downloading reports from your system and providing you with some trends. So we will look at where things were last year, last month, compared to where they are today, and provide that analytical information to practices.
Medical Advantage Group is helping practices like yours to receive much more of the money you've earned with your services, revenue that is now being lost due to billing and revenue cycle management challenges. On average, the Medical Advantage Group RCM team has helped our client practices to recover 30% of lost revenue. That translates to an additional $450,000 in additional income per practice. With Medical Advantage Group, our practices have submitted an incredible 96% of their claims within 24 hours of the care provided. Those extraordinarily timely submissions help drive improved accounts receivable payment speed and percentages. In fact, Medical Advantage Group practices have seen a major reduction in 120-day accounts receivable all the way down to 12.7%. Compare that with a typical 120-day AR file of 25 to 35% of claims submitted. Further, we're proud to say that a Medical Advantage Group RCM Services client has never been singled out for an audit by a payer. Your practice can solve your billing challenges and receive the hundreds of thousands of dollars in revenue you may be losing today by working with Medical Advantage Group.
So once we've taken over their revenue cycle, most practices are feeling relieved because they don't have to worry about day-to-day, how is this going to get done? Is it going to get done? They know that we're there. We definitely enjoy hearing from practices and hearing how much better it is now that they've signed with us versus where their account was before, and them not having to feel like they worry about it or they're not sleeping at night.
Medical Advantage Group has a 20-year track record of helping practices improve their care quality, performance, and profitability. To help your practice solve your billing and revenue cycle management challenges, contact Medical Advantage Group today.